So we have to activate the vitality line and bring it up to the top and work down. Now, this is a compressed 100 scale. It's all proportionate. So we start at 25 and we work down. Now, I've been using this for 40 years, and it's very standardized. You're not going to find anyone above the 20, especially on a first test. So 20 would be kind of what you're aiming at. Now, in this subject now is giving me a reading there of 17. She's had a lot of treatment. Okay, the second item then is to judge on a scale of 1 to 10, what's the level of blockage on the mental and emotional side. Now, again, this lady has had a lot of work done on herself, and she's pretty good on the mental and emotional side. But if you find readings up at, we'll say, 80, these are unprocessed emotional blockages that need to be attended to. At 9 out of 10, this is the bad side of the scale up here. At 9 out of 10, they will be having the occasional panic attack or a feeling of panic. Now, the question you're asking in relation to food sensitivities and food intolerances is a general assessment of how big a factor it is. So on a scale of 1 to 10, the allergy factor. Now in this case, she's still around 7. That used to be about 9 because she's avoiding most of the things that irritate her. Now the nutritional deficiency. Everyone is a bit deficient. That's not a gross deficiency. Remember, this is the bad side of the scale. So if you find the person way up at the 8s and 9s on the nutritional deficiency, their bowel is not absorbing the food, or they are anorexics or something of that nature. Now, in relation, we'll say, to the insulin deficiency, again, we measure along the scale to see how big a factor it is. Now, in this lady's case, it's not a big factor, but if you're getting readings up around here, it means the person is going towards diabetes. So in general terms, it's a general reading, it's not a clinical reading. It tells you, once it passes the 50%, it tells you whether that is a factor that needs to be considered.